Many tremendous technological advances that are available to the citizens of Ventura County. One of the things that worries me most about when I'm moving down the freeway is looking at the car next to me and seeing someone kind of weaving at the wheel, starting to fall asleep. In the workplace, I worry about people who just can't quite seem to stay awake. We have a new resource and other resources here to really help take a look at why we're having problems with staying awake. With my next guest, could you explain to us a little bit about yourself and why it is people might have a hard time staying awake during the day?
Well, thanks for having me here. My name is Andrew Duncan. I'm a physician assistant with Arete Sleep Health, and we have recently opened a sleep lab here in Ventura County and are looking forward to working with the people of Ventura County. I'm affiliated with the Sleep Disorder Center in Santa Barbara with Dr. Binder and have been working with him for the last 2 years now. The daytime sleepiness, or as we call excessive daytime sleepiness or hypersomnia, is a very common but frequently missed problem amongst most Americans. I think that pretty much every American would fall into one of the 6 categories of sleep disorders at some point in their life, and it causes significant morbidity as well as mortality in the community. However, it's completely preventable. So we really need to get a move on with preventing these problems.
Well, as a physician's assistant, you help to take the histories from the patients as well as do the exams?
I help see, evaluate, treat, diagnose, follow-ups, prescribing, as well as assisting with the durable medical equipment aspects of.
Well, tell me a little, what's a story you have of, do the wives get upset at their husband snoring, or what kinds of questions do you ask and what kinds of answers do you get?
We see all sorts of interesting cases in sleep disorders, from the wife who hasn't told her husband of 40 years that he snored the whole time, to the wife or the husband that has slept in another bedroom for many years because of the sleep disruption. However, snoring is just one of the hallmarks of a nocturnal sleep disorder, and it is often what gets someone in to see us. However, we later on diagnose them with several other sleep disorders which significantly change the quality of a person's life. For example, we have someone come in, it's the snoring that their wife has complained about. However, the breathing pauses that have been going on for 40 years have not been really mentioned. And it's the sleep apnea that leads to significant detrimental performance while driving, amongst other sleep disorders. But sleep apnea is probably the most common cause of excessive daytime sleepiness that we deal with on a day-to-day basis. Sleep apnea also has been shown to lead to weight gain, high blood pressure, acid reflux, atrial fibrillation, heart disease, stroke. It's been also shown to be associated with migraine headaches, in addition to ED and excessive daytime sleepiness. And as a practicing clinician, and those of us that do practice medicine see this on a day-to-day basis with a lot of our patients. Unfortunately, we weren't trained in our school aspect of medicine to really be looking at these clusters of things that are associated with sleep apnea.
So all of erectile dysfunction isn't cured with Viagra. A good night's sleep would help out?
Actually, a good night's sleep and eliminating obstructive sleep apnea can make a significant difference in someone's life. The thing about sleep apnea is it's completely preventable, and you can change someone's life drastically simply by eliminating the apnea.
Well, you're speaking about equipment. Is this a giant vacuum cleaner hose that people put up their nose?
No. Fortunately, as technology advances, so do the machines. The rate limiting factor is frequently getting something certified by the FDA, which takes time and money. So often the technology follows behind several years due to that government agency. However, the device that we use most commonly for the treatment of obstructive sleep apnea is a CPAP, which stands for continuous positive airway pressure. Essentially what obstructive sleep apnea is the collapsing of the upper airway when we fall asleep. Everyone's upper airway relaxes to some extent when they fall asleep, It's just really a question of how big the airway is to start off with. So it's simply a mechanical problem, and all that the CPAP device does is splints open a collapsing airway. I ask myself, is it this simple? And sometimes it really is. Fortunately, the devices we now use are a lot smaller and a lot more user-friendly and simply can fit under the nose and in the nostrils. And it makes for much greater compliance and also a much healthier patient.
Well, could you describe a little bit about what it would be like? Would I go in at 10 in the morning and get wired up with all kinds of things? When are sleep labs open?
We are open 24 hours a day, essentially, between seeing patients during the day and doing sleep studies 7 nights a week. How many studies do you order for your patients that essentially you ask them to show up somewhere and fall asleep? It's really a painless experience. It involves coming into the lab between 8 o'clock and 9 o'clock in the evening, depending on your normal bedtime, and attaching electrodes and wiring and sensoring devices, essentially from head to toe. Fortunately, nothing is painful, and the wonderful thing about sleepy people is they fall asleep anywhere with anything wired to them. And the great thing about sleep medicine is it's completely objective, and so when a patient falls asleep, we get objective information, and it's very useful.
Well, can any physician read these? Does it require any special certification to read these sleep studies?
There are several people that read these sleep studies. Most of them are board certified in sleep medicine. Sleep medicine evolved from multiple categories of subspecialties. Dr. Binder, as he likes to say, is a recovering critical care pulmonologist, and they were the first ones to see apnea. The neurologists are the ones that frequently see the narcolepsies and the restless leg syndromes and the other associated with neurological disorders. The insomnias were often treated by psychiatrists. And now we have a single specialty that addresses all the 6 categories of sleep disorders. And it's a wonderful thing to have.
Well, in terms of helping people to breathe easier, which is really our theme for today, besides the use of the CPAP, what are some other things? I know there's some surgeries and laser techniques and...
There are several options for treating sleep apnea. The sleep study will actually predict which will be the best treatment for a person's apnea. Some people, I like to say, are equal opportunity apnea patients on their backs, when they're sleeping on their sides, probably hanging upside down from their toenails, they would still have apnea. For those patients, CPAP is the gold standard. There are certain patients that only have apnea when they are on their back, supine related, and those patients often can be treated simply by having them sleep on their side. There are oral appliances that advance the mandible to pull the tongue out of the way as well. Surgery is an option. Surgery is usually a last option for sleep apnea because the success rate in general has not been greater than 40%. However, if the patient has an MRI of the upper airway, you can increase the success rate based on certain anatomical findings to close to 87%.
Well, that sounds great. I think one of the favorite devices I've ever seen was one of my patients took a bra and put some tennis balls in it, sewed it on the back of their husband's t-shirt so that every time he laid on his back he'd have to move to one side or another. And is the solution sometimes just that simple, just sleeping on your side?
It is sometimes that simple. My father actually has supine-related breathing disorder. He stops breathing approximately 60 times per hour when he's on his back. We had him do a sleep study, a polysomnogram, at which point we confirmed that he had no apnea on his side. He now sleeps with a pillow between his knees and one behind his back, so he physically cannot turn on his back.
Well, that's just great. I really appreciate everything that you've brought to Ventura County.